This video is about meniscus tears and the treatment options to include either a meniscus repair or a partial meniscectomy. The meniscus is a piece of cartilage that sits inside of our knee, between the femur and the tibia. It provides some cushion to the knee, which helps prevent arthritis from forming within the knee. It also can provide some type of stability within the knee. A meniscus tear can happen in all age groups, so from teenager all the way up to 70 or 80-year-old patients. Typically, depending on the age of the patient, the mechanism of injury is typically very different. In a younger patient, in order to tear a meniscus, this is a more robust tissue, and so typically these tears are involved from a pretty severe or major mechanism of injury, which usually surrounds some type of sporting endeavor. In an older patient, the quality of this tissue starts to decrease and becomes a little bit more friable, and most of the time these tears happen from no real known mechanism of injury, and a patient just begins to experience pain gradually. In general, when a patient comes to my office with a meniscus tear, they're always complaining of knee pain and knee swelling. There are two meniscus. There's one on the inside of the knee called the medial meniscus, and there's one on the outside of the knee called the lateral meniscus. So depending on which meniscus is torn, that'll usually be where the patient is experiencing the pain. Most patients will have a knee effusion or swelling of the knee, and the symptoms are typically worse when ambulating and specifically when bending and twisting the knee. Most of the time these tears are in the back of the knee, so when patient bends and puts weight on the knee, that is usually when this is aggravating to the patient. Meniscus tears can come in all different shapes and sizes, so sometimes these tears can be very small flaps that only bother the patient sometimes, and then the tear will kind of get into a good spot in the knee and not cause issues for the patient. So it's not uncommon for me to hear a patient say that they'll have a couple good days and then a couple bad days. There can also be much larger tears, which are usually symptomatic for 24 hours a day, 7 days a week, and don't really let up because of the size of that tear. Whenever a patient comes in to the clinic and there's concern for a meniscus tear, we will always first get x-rays just to make sure there's no fractures and judge for any arthritis in the knee. The next step for formally diagnosing a meniscus tear would be to get an MRI. An MRI allows us to see the meniscus, can allow us to see the type of tear, the pattern of tear, and also allow us to see if there's any additional injuries to the knee, such as a ligamentous type of injury or an injury to the articular cartilage of the knee. Once a diagnosis of a meniscus tear is made, there's in general two different ways this can be treated. This can be treated with a meniscectomy or a partial meniscectomy, in which just a part of the meniscus is cut out and shaved down, or it can be treated with a repair, in which stitches are placed through the tear with the hopes of this tear healing. There's a lot of things that go into the consideration with whether I recommend a meniscus repair versus a partial meniscectomy. The most important thing is probably the patient's age. It's very rare to perform repairs in patients that are over 40 years old unless it is a very, very large tear that involves the majority of the meniscus. The quality of the tissue decreases as we age, and in a lot of the times the success rate of repair is not as high once patients get over 40 years old. Additionally, different tear patterns are more amenable to repair with a stitch. If the tear is in a pattern which is very easy to pass a stitch through, and if the patient is younger, then that would be a patient we would recommend repairing with a stitch. The surgeries are both very short, whether we're performing a repair or a meniscectomy. This is usually a surgery that's no more than 30 or 40 minutes. The Post-operative recovery is very different compared to if we perform a repair versus a meniscectomy. If we perform a meniscectomy, I typically recommend patient to be on crutches or a cane for just a couple days to let the swelling come down, and then there's really no restrictions. So it's full weight bearing is tolerated, full range of motion is tolerated. Therapy begins immediately after surgery. I would expect a full recovery in about 6 weeks. If a repair is performed, then that repair has to be protected, and so a patient will leave the operating room in a brace. We do allow motion from day one, but when the patient is weight bearing, the brace has to be locked in full extension. So they're weight bearing in full extension for 6 weeks. The brace is removed after 6 weeks, and normal activities or more normal activities are resumed, but typically a patient cannot start to perform more aggressive cutting or rapid deceleration until closer to 3 months. Overall, I would consider a patient fully healed from a meniscus repair at around 4 to 5 months. The big advantage of a meniscus repair, if it succeeds, is that the patient has the entirety of their meniscus. Whereas in a meniscectomy, some portion of that meniscus is removed, which puts a little bit more pressure on the cartilage of their knee. Either way, I would expect patient to return to near full activity with very minimal, if any, restrictions at the end of this surgery.